Good morning everyone, welcome back my YouTube channel. So in this video we just discuss about the biomedical waste. This is a very common topic. Okay, so let's start the video. So first we discuss the definition. Okay, so what is biomedical waste? Okay, anything which is generated during the diagnosis, treatment and immunization of human beings or any research on animals. Okay, so if you are a healthcare provider, so you are working in a hospital or any kind of laboratory department or a biotechnology institute or a research institute. Okay, so that time you are doing any test or any research or any procedure. Even in hospital you are doing like dressing, okay, or any kind of surgery. At that time you just generate the waste material. So all the waste material is known as a biomedical waste. Okay, so biomedical waste management and handling rule is coming out in 1998 as prescribed by a Ministry of Government and Forest. You just remember for the MCQ. Okay, so I hope this is a basic definition of biomedical waste you can understand. Okay, so now you continue with next topic, that is classification. Okay, so there are different classification of BMW, like infectious waste, pathological waste, sharp or a pharmaceutical waste, genotoxic waste, chemical waste, or a waste with high content of heavy metals or pressurized container or a radioactive waste. Okay, so you have to discuss one by one. Okay, so let's start with first one, that is infectious waste. Infectious waste suspected to contain pathogens like bacteria, virus, parasite or a fungi. Okay, in sufficient quantity to cause disease in susceptible host. Okay, so yeah, if you are doing any surgery or any sterile procedure, that time some body fluids are contact with your gauze piece or a bandage. If you are placed in a patient side for a long time, then might be a bacteria or virus comes and by the air, okay, enter in the body and may lead to the different kind of disease. Okay, so if you any generate the waste, infectious waste, then you proper dispose in a proper systematic way, right, as a time being, as a quick or a fast time being. Okay, so yeah, this is a basic things you have to learn. And then we just coming to the next, culture and stock of infectious agent from laboratory work. Okay, so if you are doing any laboratory test or any laboratory study for how any kind of pathogens like bacteria, virus enter into the body and it can destroy our human cells, how it can be growth and developed inside our body. Okay, so that time something is bad and waste material will be there. So all the things we have to manage or dispose at a right way. Okay, so how to dispose the all the biomedical waste we discuss in next slide. Okay, so don't worry. So now waste from surgery on patient with infectious disease or infected animal from laboratory. Okay, so now we discuss number two, that is pathological waste. Okay, it consists of tissue, organ, body parts, human fetus or animal caresses. Animal caresses means a dead body of any kind of animals. Okay, blood and body fluids. Okay, so all these waste are under the pathological waste. Okay, so now we discuss the sharp. Okay, so sharp waste. Okay, so these are the item that could cause cut or puncture wounds. Okay, including needles, scalpels or other blades, knives or infusion set, saw or a broken glass or a nail. Okay, so these all the waste under the sharp waste. Okay, so now we discuss the next category, that is pharmaceutical waste. Okay, it include expired, unused, split or contaminated pharmaceutical products, drugs or vaccine or serum. Okay, you just read, this is the basic things. Okay, so now we discuss the next category, that is genotoxic waste. Genotoxic means it have a ability to change or any effect on the genetic material, right? So genotoxic waste is highly hazardous. Okay, or it may have mutagenic. Mutagenic means it have ability to change. Mutant means sudden change. Okay, sudden change in DNA or a gene. Okay, so this is a mutagenic. Or teratogenic means any kind of abnormality or risk or developing fetus. Okay, so this is a teratogenic. Or a carcinogenic means any kind of cell that can develop the cancer. So this is carcinogenic. Okay, so this all the waste material under the genotoxic waste. So now we discuss the next category, that is chemical waste, are in the form of solid, liquid or gaseous chemicals. Okay, so in chemical waste may be hazardous means dangerous things, okay, or a non-hazardous like toxic, corrosive if pH is less than 2 or greater than 12. Okay, so flammable things, reactive things, or genotoxic things. Okay, so now we discuss the next category, like pressurized container. Okay, many type of gas are used in healthcare, right, or stored in pressurized cylinder or a cartridge, like it is also a container where placed something, and aerosol cans. Okay, so most common gases used in healthcare, like anesthetic gases, like before going to do any kind of surgery. Okay, we first do the anesthesia, right? So ethylene oxide, oxygen, or a compressed air you have to use to the patient or in environment of the hospital. Okay, so yeah, this is a basic waste material. Waste not, it is a basic things we have to under pressurized container. Okay, so now we discuss the radioactive waste. So it include the X-ray, alpha, beta, gamma rays. Okay, yeah, so if you are doing any kind of radiation therapy for a cancer patient, okay, so if you are doing any surgery for a any joint, okay, so in ortho department, okay, if you are doing any bone surgery, that time you have to use some radiation therapy. Okay, so this all the waste are known under the radioactive waste. Okay, I hope you have a basic idea about the radioactive waste. Okay, so now we discuss the next part. सो व्हाट इज द सोर्स ऑफ बायोमेडिकल वेस्ट. ओके, सो हम कहाँ कहाँ से बायोमेडिकल वेस्ट जनरेट कर सकते हैं. ओके, सो स्पेशली इन हॉस्पिटल ऑफकोर्स, और एनी काइंड ऑफ हेल्थ केयर सेंटर, और ब्लड बैंक्स, or any kind of biotechnological institution, or any kind of research institute. Okay, so where you have to do any kind of procedure, test, or other things that can generate the waste material. So this is known as a biomedical waste, right? So now we have to discuss next part, that is effect of biomedical waste. Okay, so effect of biomedical waste, first we separate my picture. Okay, so effect of biomedical waste, the improper management of biomedical waste cause serious environmental problem in term of like air pollution, water pollution, land pollution. Okay, so yeah, not discuss like which kind of air pollution will be occur, or land pollution. So this is a beyond the topic, right? You just understand, if you are not disposed on a systematic way, then may cause the air pollution, or a water pollution, or a land pollution. Okay, or it may cause a different variety of disease to the patient. Okay, so yeah, and then we just discuss the step in the management of biomedical waste, how you can manage, okay, how you can dispose the biomedical waste. Okay, so now we discuss a basic step. First, we survey of waste generation. First step is survey of waste generated. Okay, so yeah, first in which condition we have to generate the waste, like in hospital or any biomedical in any blood banks or a research institute. Okay, so then we have to decide segregation of hospital waste. If one MCQ is there, if you ask anyone what is the first step of any biomedical dispose. Okay, so just you say segregation. Okay, not survey of waste generated. Okay, so first step is segregation of waste, hospital waste. Okay, first we generate the waste material, then we have to decide where we have to place it. Okay, there I have one like 5-6 bean according to the color code, is like red bean, yellow bean, blue bean, black bean, green bean. Okay, so you have to just decide where you have to place this waste material. Okay, suppose if a doctor doing any kind of dressing, okay, that time some gospies are there, some tubing are there, some other things will be there. Okay, so that time you decide like gospies will be placed in the yellow bag, or a tubing will be placed in the red bag, or some common cover of any medication will be placed in the black bin. Okay, so you have to just segregate of hospital waste, like step number 1. Okay, then step number 2 is collection or categorization of waste. Okay, so you have to collect after the filling of the any other color coded bin. Okay, collect and categorize like which is a infectious, which is a non-infectious, which is a dry, which is a disposable, which is a non-disposable, like that. Okay, and then I hope you understand this step. Okay, so now you understand storage of waste. Okay, then will all the waste material will be collect and go for transport, and then treat of waste and then dispose. There are 4 5 kind of method that can help to dispose the all biomedical waste according to the variety or category of biomedical waste. Okay, so now in the next slide we have to study about the how you can treat with waste material. Okay, so our next, you just read all the things we have written form. Okay, like collection, all the things. Okay, so now we discuss the method of disposable for biomedical waste. Okay, so this is the picture you have to see like this is a autoclaving machine, or this is a incineration machine, or this is a microwaving, or this is a chemical method. Okay, so now we discuss one by one. Okay, so first we discuss the incineration technology. Okay, this is the high temperature thermal process employing combustion of the waste under controlled condition for converting into inert material or gases. Okay, कुल मिला के हाई टेम्परेचर पे इसको बर्न करते हैं और डिस्पोज करते हैं. Okay, so this I just show some basic image for incineration. Okay, so this is a machine. Okay, this is a machine for incinerator. Okay, and you just a brief idea about the incineration machine. Okay, like process, material. Okay, so I'll show you the next image for an incineration machine like this. Okay, you just placed all the waste material here and burn. Okay, at burn with a high temperature. Okay, so these are basic things you just understand. And then now we discuss the autoclaving. So autoclaving is a machine that provide a physical method of sterilization by killing bacteria, okay, virus, or even spore present in the material. In general, an autoclave is run at a temperature of 121 degrees Celsius. Temperature may be differ, okay, according to the temperature. Time will be different. Okay, for 121 degrees Celsius, timing will be 30 minutes. Okay. So we just see the autoclaving machine. Okay, so this is the autoclaving machine, right? So an autoclaving machine that uses steam. Okay, use steam under pressure to kill harmful bacteria, virus, fungi, or spore on item that are placed inside the pressure vessels. Okay, so you can just understand which kind of method of disposing of biomedical waste can use the steam under pressure for the killing of pathogens. Then you can say autoclaving. Okay, so I hope you can understand the basic things about the autoclaving. Okay, so now we discuss the next things, that is microwave irradiation. At a frequency of itna and a wavelength itna, microwaves destroy the majority of microorganisms. At a proper frequency or a proper wavelength you have to provide, by the radiation will destroy all the pathogens. Okay, this is also this is a very expensive, I think, method to sterilize or to destroy the microorganism. Okay, so next we continue with chemical methods. Like for the chemical methods we have to use chemicals like 1% hypochlorite solution can be used for chemical disinfections. Okay, I hope you just understand the basic things of method of biomedical waste disposal. Okay, so one method is also there, like deep burial method. Okay, deep burial. Okay, deep burial means you have just 1 to 3 meter depth. Okay, and then we place all the waste material and cover. Then it can take some time and destroy or dispose easily. Okay, so these are basic things or a basic method. Okay, so now we discuss the chemical sterilization. Oh, sterilization means free from any kind of microorganism. Okay, so this is two types, gaseous or a liquid. For a gaseous sterilization we just use ethylene oxide, formaldehyde, nitrogen dioxide, or ozone. Okay, for liquid sterilization, we just use hydrogen peroxide, glutaldehyde, or hypochlorite. Okay, so these are basic things you just read. Okay, no need to remember. Okay, so now we discuss the main topic, that is segregation of biomedical waste, where you have to place according to the waste material category. You have to place like yellow bin or red bin or a white bin. Okay, so let's just read. Okay, I just placed some common waste material. Okay, where you have to place in yellow bin or a red bin or a blue bin. Okay, so you can just remember. Okay, so now we discuss like yellow bin. In yellow bin we just placed human or anatomical waste like human tissue, amputated part, placenta. Okay, and then soiled waste like dressing, bandage, cotton swab, or a blood bag we have to place in yellow bin. Like expired or discarded medicine or a cytotoxic drugs or a chemical waste, disinfectant, or a discarded linen or a bed. Okay, so all the waste material we have to place in the yellow bin, right? And then for the treatment or for the disposing of the biomedical waste, you have to use incineration method or a deep burial methods. Okay, you have already discussed in previous. Okay, so now we discussed which kind of waste material we have to place in the red bin. So contaminated waste like recycle. Okay, so like tubing, all the plastic things we have to place in. Okay, so tubing, IV set, catheter, NG tube, used gloves, or IV plastic. Okay, or a specimen container, vacuum, or urine bags, or a syringe without needles. Okay, so all the things you have to place in the red bin. For the treatment, you have to use which kind of methods like autoclaving, microwaving, chemical treatments, and sent to recycling. Okay, all the things you have to use for treatment of red bin waste materials. Okay, so now discuss the blue. Okay, blue bin you have to place the just glassware things like vials, ampoules, or glass bottles, or a used slide for any checkup. Okay, or a metallic body implant. Okay, so for the treatment you just use disinfection, autoclaving, or microwaving. Okay, so now we discuss the white container. In white container we just placed puncture or leak proof container. Okay, like syringe with, without needle, syringe with fixed needles. If syringe without needles, then we have to place in red bag. Okay, needles and scalpels and blades we have to place in white container. You have to learn. Okay, treatment like auto or a dry heat sterilization you have to use for the dispose of the white container biomedical waste. Okay, so now you discuss the general waste. For a general waste, okay, you have to use in previous only just use the black bag, but nowadays you have to use blue bin or a green bin. Okay, for a dry waste you have to use the blue bin like paper, glass, normal plastic, or a cardboard. Okay, for the wet waste you have to use green bin like vegetable or fruits or flowers or any kind of other foods. Okay, you have to discard in the green bin. Okay, green bin is a new term, you just remember. Okay, so this is a, so now just important things, if मरकरी का कोई थर्मोमीटर है टूट गया तो उसको फिर से कलेक्ट करके यूज कर सकते हो. Sputum is cleaned by a 5% phenol or bleaching powder. MCQ just remember. Okay, and disposed by a burning on paper. Okay, controlled tipping or controlled burial is most satisfactory method of disposable where suitable land is available. Of course, this is a past और previous बहुत पुराना मेथड है कोई भी बायोमेडिकल वेस्ट को डिस्पोज करने के लिए. ओके, nowadays in especially hospital, okay, or in waste are generated in the hospital will be mainly disposed by the method of incineration. Okay, so yeah, CPCB, so Central Pollution Control Board will be decide and give some guidelines or a management how to manage, okay, the biomedical waste under the board of CPCB. You just remember. Okay, so some basic level like you just take a triangle and write C, that means this is a cytotoxic sign, or like this you just understand this is a biohazards and most dangerous waste. Okay, or a recyclable like this is a recyclable sign, or this is a radiation sign, or this is a biohazardous or a cytotoxic sign. You just remember. Okay, sign sometime MCQ will be come from here. Okay, so now you coming to the last point, that is a my YouTube channel. Okay, so if you are not subscribed my channel, so please subscribe my channel and thanks for watching my video. हंसते रहो, मुस्कुराते रहो, मिलते हैं अगली वीडियो में, तब तक के लिए है वाह, नाइस डे।